these nuances, how do you go about when you medicate somebody that comes into your office? Like, do you have like a baseline for every single patient, or is it based on their history?
It's a great question. Nobody's ever asked that, so it's fun to share. I'm way on the deep end of the science, and I'm a loner there. I don't know that there's anybody that loves the science so deeply. The clinical day-to-day reality is very different. And we think of medicine as prescriptive. I'm going to a doctor, I'm getting a prescription for this pathway which is messed up in my brain, based on studies and what the doctor thinks is best for my brain. Cannabis medicine, in a clinical sense today, is old school medicine. It's not just shamanism, because this stuff is actually working. But I can read all these studies and I can tell you what's happening, but I can't tell you in the person in front of me because I can't study them. I don't have testing, I don't have analysis of their body in a way that gives me insight into this. Even if I used every single test that exists now. And there are companies out there which will say, you know what, give me your genes, I can tell you what cannabis you're born with. And it's bullshit. Because when you have a good day, you have a good sleep, it's going to be totally different. Your endocannabinoid system is dynamic. So it's a real interesting problem. If I'm in a room with somebody and I don't have access to who they really are, I have to bring them to a formulation which I know has worked for other people. So I'm doing shamanism not in the hand-holding, I hope you're feeling well, I'm here for you kind of sense, which actually is therapeutic in its own right, but I'm bringing them into a mixture which won't make them feel awkward. Maybe they don't want to be high, so I'll recommend products which don't have any euphoria. Or they want to feel a sense of control because they've been in pain forever and they want to have command over that. So then I would pick stuff which is not going to have a weird timeline. They'll have a very concrete, controllable timeline. So I'm using more basic principles and giving them to the patient in front of me because I'm reading what they need. That make sense? It's not a level of chemistry. This is necessary for the industry, but it's not necessary for my patients. Yeah.